Thank you everyone for joining us today. We just want to give everyone a few moments for them to, everyone to join in on our webinar before we begin.
Hello, everyone. We thank you for attending our webinar today, Quality Counts, How to Download and Use Your 2016-17 NQI Reports and Prepare for 2017-18 Reporting. Now, first, if you can please help us with our attendance count. If you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room with you. For example, Tammy Jones +3. This is very helpful with our final attendance count. Thank you. Also, just to go over a few reminders, all of our attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the Zoom control panel in the Q&A icon located in your Zoom toolbar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days, along with a PDF version of our slides. Please also visit School-Based Health Alliance for additional archived webinars for topics such as the ones you are currently viewing on your screen. School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. When health and education come together, great things happen. Attendance improves. Conditions like asthma or diabetes are better managed. Behavioral health issues get quick expert attention. And we all know that healthy students make better learners. I would now like to introduce our presenters today. We have Haley Love and Samira Solomon-Poor. Haley and Samira are part of School-Based Health Alliance, National School-Based Health Alliance Research and Evaluation Team. I will now turn it over to our presenter, Haley.
Good afternoon, everyone, and thank you so much for joining for this webinar this afternoon. My name is Haley Love. As Tiara said, I'm the Director of Research and Evaluation with the School-Based Health Alliance. And presenting along with me is my colleague Samira. We're thrilled that you're here. We're thrilled that you're here for this exciting landmark and this initiative when we now have data. You all have reported data for the 2016-17 school year and can now view your data in reports. It feels like a long time in the coming, so we're excited to be here together with you this afternoon to talk about it. So we're going to spend the next hour of our time together with a quick overview of what is the National Quality Initiative and Quality Counts. I assume that the majority of you on the webinar don't need reminders about what the initiative is, but for anyone who may be joining us who's less familiar, we're going to give a very brief overview. We're going to talk about how to access and use the 2016-17 school year reports, share some initial feedback on the reports, discuss common challenges and errors in reporting, discuss how to set improvement targets, and how to prepare to report data for the 2017-18 school year. And we'll finish off our hour together with time for questions. So what is the National Quality Initiative and Quality Counts? In 2014, so almost 4 years ago now, the Maternal and Child Health Bureau awarded the School-Based Health Alliance and the Center for School Mental Health a cooperative agreement to establish a set of standardized performance measures for school-based health centers. So this initiative is challenging the school-based healthcare field to adopt and report the first ever set of standardized performance measures. So what does this make possible for the school-based healthcare field? We believe that if school-based healthcare programs can align priorities and voluntarily collect data in a standardized way, we'll really be able to describe the quality of care being delivered in school-based health centers at the national level, which is really paramount to the sustainability of our model. We think that by reporting standardized data to the Alliance, school-based healthcare programs will be able to compare themselves at local, state, and national levels, unlike they've ever been able to do before, and assess their strengths and areas for improvement. And that by investing time in assessing our data and identifying ways to improve practices, we're going to improve the quality of care that children receive. So we have a really ambitious target. We want to see 100% of school-based healthcare programs voluntarily adopt and report standardized performance measures. So what are these standardized performance measures? Many of you were likely involved in the process, which engaged about 100 stakeholders who came to consensus over a 6-month period on what we are calling 5 clinical performance measures. These 5 core performance measures include an annual well-child visit, an annual risk assessment, BMI screening and nutrition and physical activity counseling, depression screening, and chlamydia screening. We're really happy with these measures. They align with existing national child quality measurement frameworks like HEDIS, CHIPRA, and Meaningful Use, allowing school-based health centers to compare themselves with one another as well as other healthcare settings. And they encompass child and adolescent measures and as well as a range of prevention activities that school-based health centers do so well. And we're thrilled about these measures because for the first time, it allows us to compare apples to apples. There were and are states that have performance measures for school-based healthcare programs, but their definitions and thematic areas vary slightly. And so what this set of core performance measures does is allow us to all be adopting, documenting, and reporting uniform definitions to be able to describe the work that we're doing in the same way. So since we started in 2014, a lot has happened. We've brought in and worked with a group of early adopting school-based health centers to identify promising strategies, challenges in adopting and reporting performance measures. And for the 2016-17 school year, we invited the whole school-based healthcare field to report the performance measures. And the field was asked to do this through our national school-based healthcare census. So for the 2016-17 school year, there were about 600 school-based healthcare programs who reported one or more of the measures. As you can see in this slide, these are the locations of the school-based healthcare programs that reported one or more measures. They're located in 34 states across the country, and we're thrilled to see such a high level of participation. In this slide, you can see the number of school-based healthcare programs reporting one or more of the measures by state. So you can look to see if your state is represented and how many programs in your state participated in this important first round of reporting data for this initiative. And now, because you reported data, you can download a report to view your school-based healthcare program's data and compare it to others in your state and nationally. The reports look like this. On the first page of the report, you'll see a bar chart which shows each of the measures and how they compare to state and national averages. There are also tables which show you the percentages, the number of school-based healthcare programs reporting each of the measures, and how you compare to state and national averages. So I want to talk through how you download a report. I sent emails out to everyone who reported a performance measure. And so you may have already downloaded your report, but I want to go through the nuts and bolts for anyone who may not have done so yet. So what you're going to do is you're going to first go to our website, www.sbhforall.org, and click on Log In. You'll be asked to enter your username and password, and that will take you to a screen that looks a little bit like this, and allows you to select from a menu of options, and we're going to ask you to select NQI Data Portal. Once you select NQI Data Portal, you'll be taken to a page that looks like this, and you're going to click here to download your report. Once you click there, you might need to wait about 25 to 30 seconds, and you'll be taken to this page, which is your menu of options for what data you'd like included in your report. You can select to include all SBHCs in your state or all SBHCs participating in the country. And then you'll be asked to select which of the performance measures you'd like to include in the bar chart. So it may be that your school-based healthcare program is only focusing on and therefore only reported data for the annual risk assessment. So in this instance, you would just want to click on annual risk assessment. And then you're going to hit Run Report at the top of the screen. It'll download a report that looks just like this, as I showed you before. You can view how an SBHC program compares to state and national averages. You can view the number of SBHC programs reporting the measure nationally. You can view if your SBHC program exceeds or is underperforming compared to the state average, and view if your SBHC program exceeds or underperforms compared to the national average. You'll also see in your report that we've included a number of promising strategies for improvement in the first 2 pages of the report. So when you look at your report and see, my school-based healthcare program is underperforming compared to my state average or the national average for the number of clients with an annual well-child visit, look to these strategies for improvement for ideas about how you may increase the number of clients with well-child visits. These strategies for improvement came from our learning community participants who spent the past several years working together to try and come up with these strategies that will help school-based health centers improve on each of these measures. So I wanted to share a little bit of initial feedback on the reports. From a school-based health center executive director in Colorado, it was said, the report is beautiful. I'm so excited we have access to this sort of data. Thank you for all of the work you do and for making this work a collaborative success. And we would say thank you to you, and this initiative wouldn't be possible without the collaborative work of the field to make it possible. Someone else said, I just downloaded the reports for our sites and they're amazing. They will be great to share with stakeholders. In fact, I'm presenting to the state school board next month and wondered if it's possible to show our reports with state and national comparisons. Someone else in Washington said, our organization is looking at quality metrics and reporting data to UDS. For those of you who may be unfamiliar with UDS, that is the data that's reported by FQHCs, Federally Qualified Health Center sponsored school-based health centers. Those are their national performance metrics. She says this SBHCs in our organization are leading the way on some of the quality metrics because of our work with the COIN. She's referring to the learning community they participated in. And it's great to see how our SBHCs compare to the national and federal averages. I know our organization's leadership enjoyed seeing how our SBHCs compared to others nationally. I think it's helpful for the teams to see how they rank as well. So we're going to ask you to take a moment and share with us by writing a brief note in the chat box. How could you see yourself using these reports? I'm going to pause for just a minute and let you guys share a few comments in the chat box. Don't be shy. Please share some ideas with us. It's really important to us as we try and shape and improve this work to know how and with whom you would you might use or share these reports. So I'm going to give you guys another 30 seconds to share a couple of ideas about how you might see yourself using these reports. All right, thank you for sharing some ideas with us. We appreciate it so much. We're now going to do a poll question and ask you whether you have downloaded a report yet. So the poll question should be coming up on your screen, and if you can select whether or not you have downloaded a report for your school-based healthcare program yet.
All right, just a couple more seconds and then we'll share the results.
All right, that's great. Thank you for responding. It looks like several of you have, several of you haven't. If you haven't, we encourage you to follow the steps that we just included in order to download your report. All right, so we want to share some challenges as well that people have shared with us as they've attempted to download their reports. Several school-based healthcare programs shared, I'm having trouble downloading my report. I get an error message. Another school-based healthcare program says the report doesn't have any data in it, but I reported for my school-based health center. So as you all who have participated in this initiative, with us have learned is that it's a learning process together for us to do this work together. And one challenge has been linking each school-based healthcare program with the appropriate people with permissions to see the report. So if it feels that you should be able to see a report for your school-based health center and you aren't able to do so, please just reach out to us and we'll confirm that you do in fact have access to that report and provide you those permissions. So we're going to move ahead now and reflect on more on this second comment about the reports not having data on it and talk about common errors in reporting. So Samira, I'm going to turn it over to you and ask you to share a little bit about this.
Thanks so much, Haley. So as Haley mentioned, we want to review with you some of the common issues that we saw in the performance measure reporting, which may affect data that are reflected in your own reports. So if you're noticing an error like 0% showing for a measure that you're certain you reported data on, some of the issues we'll review today might be the cause for those errors. Next slide, please. First, we saw a few errors related to client data that was reported to us. One of the most common errors was in the total clients served by the school-based health center. Specifically, either the total number of clients was not reported, or there was a large discrepancy between the number reported in the census and then reported subsequently in the NQI reporting. One reason for this may have been because the school-based health center completed the census earlier in the year and provided estimate counts at that time, and then actual counts when the NQI data were reported. And this makes sense, and usually those discrepancies weren't too large. However, we did see some pretty big discrepancies and often declines between the census and the NQI reporting. And we use the client numbers for the denominator of the well-child visit and the risk assessment calculations. So I would take a look at your data closely for those two measures. And if they look off, I would make sure they look accurate. And if they don't, might want to revisit the client data that was reported to us in the NQI portal and update those numbers. Next slide, please. Another common issue we noticed was that the client by age data were not reported. You may recall that we asked for you to report data for clients by age group. For example, the 0 to 2-year-olds, the 3 to 11-year-olds, the 12 to 17-year-olds. And we use these numbers as the denominator for the BMI measure. So if these data are missing, your data for the BMI measure specifically will show as 0% or no data. One other common issue we saw was that the total number of clients by age and the total number of unduplicated clients served differed significantly. So this discrepancy actually does not affect the measure calculations, but it could mean that the denominator for the BMI measure in particular, again, is either under or over-reported if the clients by age data are incorrect. So if you may recall, the BMI measure is based on clients ages 3 to 20. So if we don't have a breakdown or an appropriate breakdown of clients by age, then this calculation isn't going to work correctly either. Next slide, please. There are also two common errors that could affect the data reflected in the charts related to the actual performance measure components. First, some of the measures were missing either the numerator or the denominator needed for performance measure calculations. I just covered in the previous slide why some of the denominators might be missing, but if the numerators were not reported, for example, something as simple as the number of clients who received risk assessments was not reported, then the measure can't be calculated either, and you'll see no data in this for that particular measure. The second type of error was data that resulted in percentages that exceeded 100%. So for example, if the number of well-child visits exceeded the total number of clients in the denominator, this could indicate possibly that the well-child visits were a duplicate count. And in this case, the report can't do the calculation either because it's generating a value over 100%. The data tables that are provided as part of the report that you download and Haley shared earlier in the presentation contain all the data that are feeding into the charts. We'd encourage you to review these tables and make sure your data look accurate. And if you notice any issues, you can correct them in the portal, and we'll speak to this a little bit later in the presentation. Next slide, please. Next, we'll switch gears a little bit and talk about how to set improvement targets for your school-based health centers. As we've mentioned before, one main intention for the NQI data are to help school-based health centers reflect on their own performance and improve the quality of services delivered. To do that, it helps to set some targets to aim for how much you want to improve. And these targets don't have to be huge, and you can set them based on either your own data, so you want to improve your own data by X% in the year to come, or you can set them based on national data, so you want to exceed the National School-Based Health Center performance on this measure, for example. In the next few slides, I'm going to review some national data for each measure as a potential target to use for your own quality improvement goals. We'll take it both the National School-Based Health Center programs performance that were reported through the NQI initiative, as well as data from national child health quality initiatives that Haley referred to earlier, like Medicaid and CHIP and UDS for comparison when available. Next slide, please. So for well child visits, school-based health centers nationally are providing well child visits to 43% of their client populations on average. This is very close to the national average of Medicaid and CHIP programs, which provided well child visits to 44% of their clients. So this would be a great target to use for your own school-based health center. If you have an average that's lower than either 43 or 44%, you could set this as the target you want to aim for in the coming school year. Next slide, please. The next performance measure is annual risk assessments. And this measure is that the percent of unduplicated clients, the percent of unduplicated school-based health center clients with one or more age-appropriate annual risk assessment provided during the school year. Based on data that school-based health centers nationally reported in the NQI portal, 43% of their clients received an annual risk assessment. There aren't any national data on this measure, but you can, of course, use the National School-Based Health Center average as a target. Next slide, please. For BMI assessments with nutrition and physical activity counseling, school-based health centers nationally are providing 56% of their client populations with this service, while 63% of community health center clients nationwide receive this service. So by looking at these data, school-based health centers have some room for improvement with this measure in particular compared to community health centers, though this may also be a reporting issue. We know just from talking to some school health centers nationwide that for many, documenting whether both nutrition counseling and physical activity counseling was provided is a new practice. And so this may be an area in and of itself to focus on to improve on this measure, to make sure that providers document all three components of this service, that the screening was provided, that counseling for nutrition was provided, and separately that counseling for physical activity was provided. Next slide, please. For the depression measure, school-based health centers nationally reported data in the NQI portal are doing a great job providing follow-up plans for positive depression screens. So again, there's two components to this measure. If a client is screened for clinical depression and if they receive a follow-up plan if they have a positive screen. So school-based health centers nationally reported 92% on this measure. And I just want to point out, you might be noticing that the number of school-based health centers reporting for each measure differs or is declining. And for this one in particular, because it's for ages 12 years and over, it's just coming from school-based health centers that serve adolescent clients, which is why it's a smaller number than may have reported on some of our other measures. But still 92% is a phenomenal job to be doing for providing students with positive screens with a follow-up plan. And just for comparison purposes, the National Community Health Center average is 60% of clients receive this service. But just want to note that this also includes data for adults, so it's not an exact comparison. But school-based health centers are doing, again, a phenomenal job on this measure. Next slide, please. So finally, for the school-based health centers nationwide that reported data in the NQI portal on chlamydia screenings, 60% of their sexually active female clients received screening for chlamydia. And this compares to 48% of Medicaid and CHIP clients nationally. So school-based health centers, again, are performing well on this measure by comparison. Male screenings are a little bit lower. 47% of males screened by school-based health, were screened by the school-based health centers who reported data to us through the NQI portal. And there is not a national data source for comparison here, but if you are going to be using these data to set your own targets, you could again use the school-based health center national average as a target for your own health center. So again, we're sharing these data with you so you can see how school-based health centers nationwide and also child health initiatives nationally are performing as a way to set improvement targets for your own school-based health centers. But there are other ways to set targets as well. Next slide, please. So first, we would encourage you to form an improvement team made up of school-based health center providers, administrators, and also your information technology staff who may be working with your EHR or other data collection systems. And we'd encourage you as a team to reflect on your data together that was reported for the 2016-17 school year and decide on how you would want to improve a measure. We'd also recommend that you start with one measure to focus on at first rather than all 5. In our work with the National Quality Initiative and the early adopters of these measures, we noticed that when school-based health centers have a focus on one measure and start delivering that service more consistently and documenting it more consistently as well, the other measures tend to creep up with it, tend to increase along with it since they're all so interrelated. So as you all know, well child visits can include a risk assessment or a BMI assessment. So focusing on improving well child visits can then naturally lend itself to seeing a rise in your risk assessments and BMI assessments as well. And second, rather than shooting for meeting national averages that we just showed you, if your health center is not performing near those and it's going to be a too big of a jump to try to meet those national averages, that's okay. You can select a target that's slightly higher than your own 2016 school year measures for the coming school year. And of course, any improvement is still an improvement. So whether it's big or small, as long as you focus on getting these measures up, that's all that matters in terms of just demonstrating the quality improvement in any of these areas. So I saw a question come in. And Haley, are we going to hold questions to the end, or do you want me to take this question?
You can go ahead and take it.
Okay. There's a question that says, for the age breakdown, so this is going back to some of the common errors that we saw in reporting. For age breakdown, do you think it could be that they're reporting percents, not the actual counts? That's a very good point. And that could be it. So again, if you see that any of your measures are not actually reporting calculations or percentages in your charts or in that table, I think this is a great point. I would take a look at the data that you reported to us in the data portal and double check that they were actual counts reported to us and not percentages. But I appreciate you bringing up this point, and we certainly can go back and double check too to see if this may be what's going on with the client by age data. Thank you for the question. So since we're pausing, if there are any other questions about setting improvement targets or any of the issues with reporting, please feel free to type them into the chat box and we can answer them. But Haley, I'll turn it back over to you.
All right, great. Thank you so much, Samira. We'll carry on and answer all of the questions that you may have at the end, which we're nearing. So we want to talk next about how to prepare for the 2017-18 school year reporting. So we have come so far with this initiative over the past several years, and we have a long way to go. We're working towards reshaping the way the school-based healthcare field interacts with and uses data, not to be evaluative, but more so to be for quality improvement, to identify what health centers are doing well and to identify areas where we can be performing better in order to be providing the best quality of care to children and adolescents. So we are inviting school-based healthcare programs to join us in reporting performance measurement data annually. So starting from June through December of 2018, the Alliance will reopen the portal again and ask school-based healthcare programs to report data for the current the current school year, the 2017-18 school year. As you're working towards that, we want to be able to provide resources to you that can be most useful for the improvement of the care that's provided in your school-based health centers. We're distilling all of our lessons learned and promising strategies that we have learned from participants in our learning community, and they are available on our website. If you go to our Quality Counts Initiative page, you can review the performance measures. You can learn promising strategies for improving each of the measures. You can view tips on how to set up your electronic health record, and you can learn what data is being collected and how privacy is being protected. So we're going to stop talking now and open up to all of you guys to ask questions that you may have about any components of the initiative, about the reports, their components, how to download them, how to interpret them, or about our vision for the future in encouraging health centers to report this data annually. So if you can put your questions into the chat box, we'll begin answering them. So we have our first question in the chat box, and it says, can the state funder download the reports? And the answer to that question is yes. State funders who are collaborating with us on this initiative, meaning that they are working towards aligning the measures that they require their school-based health centers to report with the national measures, our 5 core measures, they will be able to download and view all of the reports for the school-based healthcare programs that report for their state. And the vision for this is that we can achieve a lot more with this more efficiently if we work together. So Jean, I see this question comes from you, and we can work to give you permission to be able to download all of the reports for those health centers who reported in Illinois. If anybody wants to review the data sharing and security policy as well, where we outline permissions as well, you can do so online on the webpage that I mentioned earlier, our main Quality Counts webpage. All right, I think I saw, hold on one second. I think I saw another question come in, 1 minute. All right. So the next question is for the BMI numbers that you showed. Did that only include data that answered all 3 parts? Samir, do you want to take this question?
Sure. So the BMI measure, we ask that school-based health centers report to us the number of clients who received each 3 of those components, so that they received a BMI assessment and they received physical activity counseling and nutrition activity counseling as one number. So you would only give us the count based on whether that client had already received each 3 of those pieces. So we get it as one count. And I think for a lot of school-based health centers, obtaining that count to make sure that each client received each of those 3 components has been a bit of a challenge. It's easy, I think, to get the number of BMI screenings out. It's easy often to get the results of the BMI screening out, but to pull those 3 components out together for each client, I think, has been a challenge. But that is our goal, that the number that is reported to us is the number of clients who received each 3 of those components.
Any other questions?
So just to clarify about BMI, we do ask for you to report the number of BMI screenings, and we do look at that. And like I said, so that actually is a the performance on that has been pretty strong, but we're trying to push the field to not only screen for BMI, but to make sure to provide nutrition and physical activity counseling to every student who is screened for BMI as well. So we do capture in the portal, we ask you to report the number of screenings provided, and then separately we ask you to provide the number of clients who received, we ask you to report the number of clients who received a screening alone, and then we also ask you to report the number of clients who received those three components: the screening, nutrition counseling, and physical activity counseling.
So the next question is, can we include visits seen over the summer in the data? The answer is yes. And we can, if you look at our measures definitions document on our website, we define the school year as a time period, from whenever your school year starts through the end of the summer, right before the next school year begins. So yes, please include the visits that happen over the summer. We want you to be reporting for a full year, but in alignment with your school year. And that's particularly relevant if you're open during the summer. Yes, good question. Any other final questions? Can we get a copy of the presentation? Of course. We will be putting the slides and the webinar recording up on our website in the next several days. So all of this information will be available online. And if you have any questions that you would like answered by Samira or myself, please feel free to reach out to either of us, and we will be happy to address them. Just a few final plugs. We would love for all of you guys to become members of the School-Based Health Alliance if you aren't already. You can visit our website to find more information about becoming a member of the organization. And we also want to encourage you to join us in Indianapolis, Indiana this summer from June 24th to the 27th for our National School-Based Healthcare Convention. Registration is currently open, so we would love to see you this summer. So thank you everyone for joining us for this webinar this afternoon. If you have questions, please direct them our way. And with that, I think we'll say goodbye for this afternoon. Thank you.
Thank you.